Hi Charlotte, my name's Grace, one of the doctors at the clinic. Would I be able to confirm your name and date of birth, please?
Yes, it's Charlotte Boreham and my date of birth is the 15th of May 1994.
Nice to meet you, Charlotte. And I understand you're here today for a speculum examination, is that right?
Yes.
Okay, so I'll explain the procedure to you. So to start with, I'll take a look at the outside of your genitals, so your vulva, to see if there are any abnormalities there. I'll then insert a small plastic tube into the vagina. This will allow me to examine the inside of the vagina and the cervix. It can feel a little uncomfortable, but it shouldn't be painful, and you can ask me to stop at any point. I would have a female member of staff present as a chaperone if that would be okay with you.
Yes, that's fine.
Do you have any questions about the examination?
No.
Are you happy to go ahead with it today?
Yes.
Okay, in that case I have a couple of questions before we start. Firstly, do you have any pain anywhere?
No.
Is there any chance you could be pregnant?
No.
And would you like to go to the toilet to empty your bladder before the examination?
No, I'm okay, thank you.
Okay, in that case, I'll ask you to step behind the curtain, and if you could undress from the waist down, including your underwear. Have a lay back on the examination couch, and there's a blanket there to cover yourself with. I'll gather my equipment, and when you're ready, just let me know and I'll come round with the chaperone.
Okay.
Okay.
I'm ready now.
Okay, I'm going to come through with the chaperone now. I'm going to examine your genitals now. So for that, please draw your ankles up to your buttocks and let your legs fall open. I'm going to sit at the foot of the bed and I'm going to use a light so that I can see better. And when you're ready, I'm going to pull the blanket back to start the examination.
Okay.
Are you happy for me to go ahead?
Yes.
Okay, first I'm going to examine the outside. I'm going to start by pressing on your groin creases to check your lymph nodes. And the same on the other side. I'm going to examine your vulva now, looking for any lumps or bumps or skin changes. Could you cough for me, please? Thank you. Next is the internal examination with the speculum. The speculum has some lubricating jelly on it, which may feel a little cold. Are you okay for me to go ahead with this examination?
Yes.
Remember, you can ask me to stop at any point. Okay, I'm inserting the speculum now. I'm going to open the speculum a little now so that I can see your cervix. You will feel a bit of pressure. Okay, going to remove the speculum now. And that's the end of the examination. Please get dressed and come round to the other side of the curtain when you're ready. There are some wipes here if you would like them. Okay, Charlotte, so the examination findings today were normal, including the outside of your genitals and the vaginal walls and the cervix. Do you have any other questions today?
No.
Okay, in that case, that's the end of the consultation.
Great, thank you.
Today I examined Charlotte, a 28-year-old woman. Abdominal examination was unremarkable. An examination of the external vulva was normal. I performed a speculum examination, which revealed a healthy-looking cervix with a closed Rs. In summary, this examination did not reveal any abnormal findings. In order to complete my assessment, I would arrange the following further investigations. Check out the Geeky Medics collection of over 1,000 OSCE stations. You can practice with friends using our group study mode or chat with our amazing AI-powered virtual patients.